Welcome back. You're live on the Health Hub in collaboration with the Bhekisisa Center for Health Journalism. And today we're unpacking all issues to do with long COVID. You might have heard about it in passing, but we've heard from two patients, Sarawat and Nina, who've, I guess, explained to us the impact that it's had on their lives. But Mia Malan, who's the editor-in-chief at the Bhekisisa Center for Health Journalism, is with us in studio. And Mia, now we're trying to unpack the kind of interventions really that exist to try help people who do develop long COVID.
Yes, Yanda, and we're also trying to figure out how do you know if you've got long COVID, just how long is long and what kind of symptoms do you need to have. So to help us figure that out, we have the head of South Africa's only long COVID clinic here in South Africa. It's based at Groote Hospital, and we're going to speak to the person who heads that up, who is Dr. Rubeshan Perumal. And he, as I said, is based in Cape Town and is joining us. Dr. Perumal, welcome and thank you for your time on the show. How do you know if you have long COVID? How do you know if the symptoms you have qualify for long COVID?
Well, good morning, Mia, and good morning to your viewers, and thanks for having me talk on this important subject. You know, long COVID essentially reflects the persistence of symptoms for 4 weeks or longer from the acute illness. And in fact, some patients have few, if any, symptoms during the initial period, but may go on to develop symptoms down the line. And so it includes both groups of patients, those who have symptoms which persist and those who develop new symptoms 4 weeks or more from their initial illness.
So do we have an indication as to what proportion of people who have acute COVID would go on to develop long COVID?
Well, we're slowly beginning to understand that long COVID can occur across the spectrum of initial severity. So patients who are severely ill in ICUs go on to develop long COVID, but some patients who are minimally symptomatic may also go on to develop long COVID. Of course, across that gradient, there's a greater risk of developing long COVID if you're more severe during your initial illness. But on the whole, about 30% of patients are unrecovered at 3 months from their initial diagnosis. So, you know, that's a substantial number of people. 30% of the 2.8 million or so South Africans who've had confirmed COVID-19 leaves us with an expected estimate of about 900,000 people, almost 800 to 900,000 people in South Africa who already need long COVID care.
So if you then give them care, what are the types of care that such patients need? Because you've mentioned there's such a wide range of things that can go wrong. So I would imagine it's a very holistic approach.
Really, what is needed is a multidisciplinary approach. You're quite right. The symptoms which patients present with are quite varied. The most common of them are fatigue, persisting shortness of breath, an intractable cough, cognitive difficulties, or what patients describe as brain fog, sleep disturbances, anxiety. And so you can see that these sort of symptoms can arise from many different places. Sometimes we're not even able to identify where the source of the symptoms are, but we really need a multidisciplinary approach, a good, thorough evaluation of the patient to separate out what are complications from the acute illness, what is coming from organ damage from the initial illness, and what is really this entity of long COVID, which is an almost inexplicable persistence of symptoms in patients who sometimes have normal tests when we evaluate their organ function and so on. And so, you know, at our clinic, we have a broad multidisciplinary team. It's led by pulmonologists like myself, who have our primary interest in the lung. But we've, very quickly realized that we weren't going to be able to, attack this problem by just looking at the lung. And so we have a neuropsychologist who has to look at the patient from their cognitive perspective. We have teams of allied health professionals, including physiotherapists, occupational therapists, dietitians, and we readily call on the diverse network of providers in Groote Hospital to support and evaluate patients on all the other fronts: cardiac, neurological, hematological, and so on. So, you're quite right.
Dr. Perumal, thank you very much for your time and sharing your expertise today. That was Dr. Rubeshan Perumal, who joined us from Cape Town, and he heads up South Africa's only post-COVID clinic at Groote Hospital.
Sure. Incredibly important information that. But of course, we know the Health Hub is not just about COVID-19. It's got to do with all health matters, at least those that matter to you. And Let's move away from COVID-19 for just a moment, Mia, and reflect on another health issue that's been making headlines over the past couple of days, and that's to do with teenage pregnancies. It's an issue that has taken a lot of people by surprise, especially once you consider the numbers. There was a lot of shock value to just how many teenagers are falling pregnant. But I wonder how we move away from that and start discussing perhaps, I don't know, interventions, education to try shift the tide.
Yes, Ayanda, and I think one way to address that is to equip parents to talk to their teenagers about sex, because it really does start at home. But that is so uncomfortable for so many parents. And you know, I'm a parent myself. I have an 11-year-old daughter, and I would like her to feel comfortable to ask me questions that she has about sex so that I can answer them rather than someone outside of my home. But that is, of course, easier said than done.
Absolutely.
So what we're going to do today is we are going to speak to a sex educator who talks to teenagers about sex all the time and ask her how she does it so that us parents can learn from her. So we are joined on the line by Mamello Sejake, that is from Cape Town. Thank you very much for your time today, Mamello. Let's get straight into the issue. What are the most common questions that young people, particularly teenagers, ask you about sex?
Good morning. So they often ask me about how to increase pleasure in their sexual lives. They ask me about different forms of contraceptives because they don't always want parents to know that they're on contraceptives. They ask me how to ask their partners to use a condom, and they often tell me about stories about having sex, and a lot of the times they don't know that they were coerced into having sex.
Mamello, you've been doing sex education for many years, but so many parents feel so uncomfortable when they have to speak to their teenagers about sex. So to help this, can you give us an example of how to do this? Let's say I'm a teenage girl and I need to negotiate for the use of a condom with a partner so that I can protect myself from falling pregnant or contracting a sexually transmitted infection. What would you tell me?
I would suggest that they speak to their partners about using a condom beforehand and tell them that if they won't use a condom, then sex is not something that they're willing to engage it with. I would suggest that they carry their own condom so that they do not find themselves in a position where there is no condom, but they want to have sex. Or I also suggest that they use the internal condom, which is also known as the female condom, and they can keep that inside of them for up to 7 hours prior to having sex.
Mamello, we so often hear that it's a girl's responsibility to make sure she doesn't fall pregnant and uses contraception. But it takes two people to have sex, of course. So how do we address this issue with boys?
So I would say to them that although they will not get pregnant if they have sex without a condom, but they can protect themselves and their partners from unwanted pregnancy if they use a condom, which they should be doing. And also using a condom protects them, allows them to protect themselves from contracting sexually transmitted infections.
So if you have to give parents your top tip on how to talk to their teenagers about sex, what would that be?
I would say that teenagers are having sex, and a lot of them are going to have sex, and they're going to look for information about sex. So it is best if they get the right kind of information from their parents as opposed to getting it from their peers. And speaking about sex does not mean that you are that you're encouraging them to have sex or that they will disrespect you. It just gives them the right information to be able to make choices to protect themselves.
Mamello, last question. So parents are uncomfortable. If you are uncomfortable about speaking about sex, how do you overcome that level of unease to talk to your child about it? What do you do?
I think the first thing is to understand that there's nothing shameful about having sex and nothing wrong with having sex. So if we think about it in that way, and it is just as natural as eating or breathing, then it might take away some of the anxiety and nerves. And to also understand that it doesn't need to be this serious, hectic conversation, but it's something you can have over a cup of tea or while you're taking a walk. And but it's not a technical thing, you know, just speak about it as something that can be empowering and gives them the tools and the tips to take care of themselves and build a level of trust and openness between you two or you and them, so that should anything happen, they feel comfortable to come and speak to you about sex. There's also plenty of resources online that can teach you and give you information and tips on how to speak to them about sex.
Thank you very much for your time today, Mamello. That was Mamello Sejake, and she is a sex education workshop facilitator who joined us from Cape Town.
Sure. I must admit, I'm sitting here in some respects cringing, not because anything wrong is being said, but I'm reckoning with how taboo even just sex education is, especially once you involve children, Mia. And I wonder what your thoughts are around whether or not any of the kind of educational interventions will be effective in a context where we haven't destigmatized even talking about sex, especially with young people.
I think you're right, Ayanda. We need to start reframing sex from something that's a sin to something that is natural, as Mamello said, and also can be pleasurable. And then talk to teenagers from a sort of like an equal perspective on it. I remember one workshop that I attended as a journalist very well. I worked for television as a reporter at the time, and I went to a school where there were also like people like Mamello who came in to teach children, basically teenagers, about sex. And the teacher or the sex educator was in front of the class and took out knickerballs and said each child must take a knickerball in the school and then put it in their mouths. And then she asked them to swap it with the person next to them. And of course, no one wanted to swap a knickerball. And she was like, why would you swap knickerballs? And you're quite comfortable to do that with sex. And there's even more serious diseases that you can contract, you know, when you share genitalia, as opposed to just normal sweets. And that's always on my mind, remembering how effective that was. And if I remembered it, I'm sure the teenagers must have remembered it as well. But most importantly, that sex educator was comfortable talking about sex.
I wonder if any of the students were happy to swap knickerballs with the people they were attracted to, because that's probably effective, but we'll probably leave it there. And that is an idea, perhaps, of how we could continue broadening the discussion around having those conversations with young people around sex, because the reality is as follows. The sex is taking place, and so the question becomes, are you in charge of at least the ways through which young people are able to get access to that information? But it's on that note that we come to the end of another really, really profound and insightful segment of the Health Hub, brought to you, as you know by now, in collaboration with the Bhekisisa Center for Health Journalism. So make that appointment, 9 a.m. on Newsfeed AM, the Health Hub, every Sunday right here on Newzroom Afrika, channel 405. Mia Malan, once again, thanks very much indeed. Always great having you around. She's the editor-in-chief at the Bhekisisa Center for Health Journalism. All right, still to come, we go back onto the news grid. In just a moment, of course, we're still digesting the news of the tragic passing of Joburg Mayor Julie D. Matongo. A lot of tributes have come in far and wide. Get your sense of those sentiments for you in just a moment. Stay with us.